Hi everybody, welcome to Health Wanted, the place to be for healthy living. Today, we will discuss alcohol use disorder, including symptoms, causes, diagnosis, treatment, and more. Keep watching until the end because there is some truly intriguing information for individuals with this disorder or those who have a family member affected by it. Subscribe to our channel so that we can provide you with essential information to help you maintain good health and well-being. Let's now go to the video. What is alcohol use disorder? While many individuals enjoy a glass of wine with dinner or a celebratory cocktail, excessive drinking can bring health and psychological harm. When a person is unable to regulate their drinking and suffers professional, social, or health difficulties as a result, they may be diagnosed with alcohol use disorder, AUD. Although the term alcoholism may be used to characterize a severe form of AUD, physicians, researchers, and others in the medical community do not. Alcohol use disorder symptoms and signs. The fifth version of the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, is used to diagnose alcohol use disorder. The DSM is a manual that explains and categorizes mental diseases. It is produced and updated on a regular basis by the American Psychiatric Association and is used by medical practitioners as a tool. To be diagnosed with AUD, you must have at least 2 of the following 11 symptoms within a year, according to the DSM-5, drinking more than usual to achieve the desired effect, being buzzed or drunk. Experiencing withdrawal symptoms once alcohol's positive effects have worn off. Consuming alcohol on occasion in excess or for a longer amount of time than you wanted to. Multiple times of trying to cut back on, or stop drinking. Wanting to drink so badly that you can't think of anything else. Consuming alcohol frequently and dealing with its after effects. Seeing issues related to drinking or its effects at work, home, or school. Sacrificing other enjoyable activities in order to drink. Drinking despite mental or physical difficulties, such as signs of anxiety or depression, or a memory blackout. Continue to drink despite the fact that it is generating problems with your friends and family. Getting into situations where alcohol has raised your chance of getting wounded or driving while intoxicated more than once. What constitutes excessive alcohol consumption? Binge drinking and heavy drinking are examples of excessive drinking. According to the Centers for Disease Control and Prevention, CDC, there are 2 categories of excessive drinking. Binge drinking is defined as having 4 or more drinks on a single occasion for women and 5 or more drinks on a single occasion for males. Heavy drinking is defined as 8 drinks or more per week for women and 15 drinks or more per week for males. Moderate alcohol consumption is defined as 1 drink per day for women and up to 2 drinks per day for men. Drinking less is healthier than drinking more. Pregnant ladies and people under the age of 21 should not drink at all. A normal drink is comprised of the following servings: 12 ounces of beer, 8 ounces of malt liquor, 5 ounces of wine, about 1 glass, 1.5 ounces, 1 shot, 80 proof distilled alcohol or liquor, gin, rum, vodka, or whiskey. Excessive drinking can be damaging health in the long run. However, increased alcohol consumption may not always imply AUD. According to the CDC, 9 out of 10 binge drinkers do not have AUD. Causes of alcohol use disorder and risk factors. A person's predisposition to alcohol misuse depends on a variety of factors, including genetic, psychological, social, and environmental ones. The National Institute on Alcohol Abuse and Alcoholism, NIA, believes that genes may account for up to 50% of the risk for AUDs. Other factors that may have an impact on the development of AUD include history of emotional or other trauma, anxiety, sadness, bipolar disorder, and schizophrenia are examples of mental illness and mood disorders. Social and cultural pressures, such as living with a spouse who drinks regularly, or, for adolescents, a parent who drinks. Beginning to drink at a young age, especially binge drinking. Heavy drinking over a long period of time. Antisocial personality disorder and borderline personality disorder are examples of personality disorders. Alcohol use disorder prognosis. Almost every organ in the body can be affected by alcohol. The effects of alcohol accumulate over time in numerous organs, and the harm becomes obvious only after years of consumption. Alcohol has an immediate effect on the brain, causing changes in mood, behavior, and judgment. The more alcohol you consume, the higher your blood alcohol levels and the more intoxicated you become. Short-term alcohol intoxication can result in vision distortion, lower inhibitions, uncertain feelings, unsuitable behavior, inappropriate behavior, memory loss or blackouts, in which you do not recall events. In severe circumstances, coma or death may occur. Alcohol withdrawal can induce debilitating symptoms hours to days after binge drinking. Symptoms may include difficulty sleeping, restlessness, nausea, sweating, a racing heart, elevated blood pressure, tremor or shakiness, anxiety, feeling low, or an overall sense of malaise, according to the NIA. Moderate to severe withdrawal symptoms can cause hallucinations, convulsions, or delirium tremens, the latter of which can be fatal. Long-term drinking can impair your immune system and raise your risk of a variety of health problems, including cardiovascular disease, liver disease, cancer, and infections such as pneumonia. Groups of rehabilitation and support groups. Excessive drinking or an alcohol use disorder can be successfully treated with therapies to assist you in changing your behaviors and allowing your brain to adapt to the absence of alcohol. Mutual help organizations such as Alcoholics Anonymous, AA, and inpatient rehabilitation are both common treatments for alcoholism. Mutual help groups educate you techniques for overcoming your compulsion to drink alcohol. AA is a 12-step program that uses spiritual principles to provide peer support. The NIAA provides a list of these support groups, including secular options. According to a 2020 review of studies, AA and other 12-step programs may be even more beneficial than other treatments, such as cognitive behavioral therapy, in encouraging alcohol abstinence for at least 3 years. The authors discovered that these programs are at least as efficient in reducing the amount of alcohol people drink and the consequences of drinking. Rehab is often a month-long treatment program in a facility that removes you from the situations and circumstances that promote substance usage. Counseling can assist you in identifying and changing behaviors that contribute to drinking, developing attainable goals, learning healthy coping skills, and dealing with triggers that lead to relapses. Standard methods used to treat other mental illnesses, such as cognitive behavioral therapy, CBT, which is often used to treat depression and other disorders, may be employed in treatment. According to a 2020 study, in addition to CBT, another form of treatment called motivational interviewing, which helps the patient identify their concerns and take action, has also shown success. Complications of alcohol use disorder. Long-term heavy drinking may cause changes in how the brain functions, ranging from memory lapses to more debilitating diseases. The influence is determined by when a person began drinking, how long they have been drinking, and how frequently and how much they drink. Long-term alcohol misuse can cause neurological problems such as short-term memory loss, abnormal thinking, and dementia. Researchers discovered that 56.6% of persons with dementia had an alcohol use disorder documented in their medical history in a 5-year longitudinal French study of more than 31 million people published in 2018. According to the NIAA, up to 80% of patients with AUD have a thiamine or vitamin B1 deficit, which can lead to Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome is a degenerative brain illness that produces, among other symptoms, mental disorientation, eye issues, lack of coordination, and memory problems. In addition to neurological issues, AUD can cause arrhythmias, stroke, high blood pressure, and cardiomyopathy, impaired heart function, steatosis, fatty liver, hepatitis, and cirrhosis, liver scarring and lasting damage, pancreatitis, inflammation of the pancreas, cancers of the mouth, esophagus, throat, liver, breast, and colon. Infections are more likely, including pneumonia and TB. Alcohol can interfere with new bone formation, causing bone deterioration, including osteoporosis. If you drink while pregnant, your kid may be born with birth abnormalities caused by fetal alcohol syndrome. This applies to everyone who drinks alcohol while pregnant, not only those with AUD. Erectile dysfunction in males and irregular or missed periods in women are examples of reproductive issues. According to the National Cancer Institute, the association between alcohol usage and breast cancer is well established, and evidence suggests that even moderate drinking, 1 alcoholic drink per day, may increase the risk of breast cancer marginally. Excessive drinking and alcohol use disorder are also linked to mental health issues such as depression and anxiety, as well as relationship and employment problems. Now, watch this video to gain some valuable tips for maintaining a healthy lifestyle. Subscribe to the channel to receive regular health tips and guidance. That's all for now, and remember to stay healthy at all times. Thank you for watching, and we'll see you next time.